Hey everyone, it's Marianne Pizzutola, president of the New York City Organization of Public Service Retirees. We are the organization that brought the lawsuit against the city of New York to stop them from forcing us into a Medicare Advantage plan. And while the case is rumbling through the court, we are currently waiting for the appellate court to pick up the appeal that the city filed against us. We are working on a series of videos to try to help educate both the retirees and the actives and the unions as to what's going on. And this is just another one of those video topics that I thought came across today. I said, you know, this would be a really great topic to be able to talk about. So today I want to talk to people who get this newspaper, the unions that get the Public Employee Press. You are a DC37 person. You either get this if you're active or you get this if you are a retiree who pays dues to the DC37 Retirees Association. So on the very front article, the head article, is a seat at the table by Henry Garrido. And he is the executive director of the district council representing the active employees and many unions under his purview. So I've tried to reach out to Henry. He doesn't seem to be available. I had a wonderful conversation with Rose Lavaglio, who did advise me that she would eventually get Henry to speak to me, but I'm still waiting, and today's April 19th. So what I thought was interesting about this article, if you guys have not read this, go up to DC37, DC37's website, and it's under news and Public Employee Press, and it is the first article that's there. And he talks about the struggle that the unions are having right now because the private hospitals charge very differently than the public hospitals do. And in doing so, it's costing the unions a lot of money when union members have to go to the hospital. So a couple of his comments in here seem to resonate with exactly the situation that we are having, but it's interesting that he doesn't see the connection. So I highlighted a few, as you could see when I held up my paper. He talks about how there is this divide between public hospitals and private hospitals, and that there is this veil of secrecy that the private hospitals have when setting the rates. And he said that this wouldn't happen if the unions had a seat at the rate setting table, which is why we are now calling hospital leadership to task. Didn't the retirees want a seat at the table when the unions tried to renegotiate our benefits? Actually did renegotiate our benefits that we paid for, benefits that we earned. So we weren't permitted a seat at that table. Actually, and Ed Hissick at one of the DC37 Retirees Association meetings said he asked Henry to be in on these meetings, and Henry told him no. Stu Eber, who is the head of COMRO, the Council of Municipal Retiree Organizations, he had said he even wrote to the MLC and got a letter from the MLC's attorney that he could not be party to any collective bargaining or seat at the table or even be in the room because he was retired and didn't have a seat at the table, or wasn't permitted one because he wasn't a organized union organization, labor organization. So next one. He talks about setting this coalition and that a seat at the table is our right. We pay for these services and deserve a strong voice in the process. That these hospitals, are horrible because they're charging well over the Medicare rates. And in some cases, he says over 300% above Medicare rates, and even more than 3 times what health and hospitals are charging. And by increasing costs while getting massive reimbursements from the federal government, hint, hint, isn't that the same situation? These for-profit health systems, hint, hint, have needlessly inflated healthcare costs to the breaking point of New York City's working families. Now, I'm just going to hit pause for a second, because for those of you that aren't really versed with Medicare, and you're not a Medicare health policy expert, Medicare Advantage is funded by the federal government to a for-profit health insurance carrier. And the subsidy that they pay well exceeds what Medicare pays on their own. Had they done it themselves? So while the position of a prudent American tax-paying citizen should be, well, if this is only costing the city $600 million, what is it actually? And it's not really $600 million, but that was another video. What is it costing the federal government? Which you'd be very surprised to find that that rate is a lot higher than what CMS, Medicare, would pay had they just done it on their own. So as a tax-paying citizen, I am putting the burden on taxpayers on a federal level to fund something that well exceeds the cost had it just been kept locally. So maybe it's not going to affect the New York City taxpayer in your city or state taxes, but it's definitely going to affect you in your federal taxes. There is no real savings here. It's actually costing you more money just out of a different pocket. This is what people just don't understand. And I know it sounds crazy and convoluted, but that's actually how it is. The federal government pays more money to a private for-profit insurer to do the same thing. And yet we should be prudent American tax-paying citizens and say, hey, that doesn't make any sense. Why are we doing this? Let's just keep it locally and find another way. So goes on, he talks about how 32BJ SEIU Health Fund, showed that certain services, their health fund had paid far more at a private hospital than they did for public hospitals, and in some cases 9 times more than the Medicare rate. Is that acceptable? Yes, I guess, inexcusable, most definitely. So he then says, if we don't work together to stop the strangulation hold by laying out a seat at the table ultimatum, then we have no one to blame but ourselves. Organized labor has the power of numbers in our corner. See, but Mr. Garrido, we are organized labor with you. We are organized labor retirees, the segment of the population that you should be looking to protect, because we were once you, and you will be in our seat. Very flippantly last year, Mr. Nespoli said, oh, well, of course I care about the retirees. I mean, we're all retirees in training. And that's really interesting that he said that, because Stu Leibowitz, who used to head DC37 retirees, used to say the same thing. But Stu, he meant it to his heart, and he would never sell out a retiree. I don't understand where this sentiment is coming from. Times are different, totally get it. You have a shortage in your stabilization fund, but I've done several videos to tell you where that shortage came from, and it didn't come from us. Today I spoke to yet another union, and this union leader said to me, well, hey, Marion, I'm really sorry. I understand that it's retiree healthcare costs that are bankrupting, the union, so we have to do something. And I said, no, ma'am, it's actually not bankrupting your stabilization fund. Let me tell you where the money went, because you did institute healthcare savings as a result of a 2014 agreement with the MLC and OLR, and you were actually saving money, albeit you did make some changes into your own plans and added some co-pays and realigned some of your benefits, but you actually did see money go into the bank. The problem is the unions took it out. And one of the biggest players in that was the UFT for taking over $1 billion out of the fund in 2014, and then kept taking it out. It wasn't that you weren't saving money, you actually were. I mean, there's plenty of articles on our website about that, and she wasn't familiar with that, and I had to redirect her to our website to learn. But this is the misnomer. So if the city keeps repeating the lie that it's retiree healthcare that's bankrupting the unions or the city, which isn't the case, you are going to believe the lie, right? Because why would you not want to believe what the city's telling you, or the MLC is telling you, because they're your union brethren? Like, we believe when the unions told us this is the same plan as take this Medicare Advantage plan, it's the same as GHI senior care. No, it's not. We actually believed you in the beginning, but it's not. And we're going to hopefully have the opportunity to share that with you this Friday. Friday we have a roundtable informational session for the union, so we do hope you attend. And Mr. Garrido, please attend, because we would love to have the opportunity to talk to you, to tell you this should not be where the road we go down. And there's other things that we've come up, we've found in the process of this last year by going through all of the contracts and the city budgets and city documents as to where there could be a savings that you could potentially use. But interesting that here you want to work together to stop the strangulation hold of, by laying out a seat at the table ultimatum, and then we have no one to blame but ourselves. We're not permitted to have a seat at the table. You've never invited us to sit with you. And when we keep saying our position on this, it's not being taken seriously. So we're kind of in the same situation as you are. You're being rebuffed by the hospitals, and we're being rebuffed by our own former unions. He writes, higher charges do not equate higher health care. That's the mindset of the 1%. Well, in this situation, very interesting, the federal government's paying more for our health care than would be the city of New York. That's one. And then two, the city is pegging the cost of that health care rate, ironically, at $7.50 and then $0 in fiscal year 2023, when we know the true cost of those plans definitely aren't $7.50. Nothing costs $7.50. In terms of a healthcare insurance plan, you can't register, insure your car for $7.50. There's no insurance plan for $7.50. The cost is somewhere. It's built in somehow. And if you go back to that teacher that I did a newspaper article about, I rebutted one of her UFT retired teacher chapter newsletters, where she said there's no free lunch. You don't get something for nothing. Well, how do I get an insurance plan that's going to cost me $7.50 if I'm supposed to trust in my heart that this plan will always be there for me? It won't. You and I both know that. If it's federally subsidized through CMS, it is a subsidy. When that subsidy changes, like did happen in 2017 with the HIP VIP subsidy, what did HIP do? HIP actually canceled the plan's prescription plan, tossed it out, gone. They increased copays and they reduced services provided under the insurance. They reduced your coverage. So you are doing to us could potentially put us in the same situation, and we are disabled, over 65, infirm, living in facilities. This is the population that you want to put into a plan that would risk their health care. I don't understand. He continues, as part of the Labor Strong Coalition, we joined with our 4 partner unions and tried to deliver more than 5,000 petitions to the New York Presbyterian Hospital management, calling on them to give us a seat at the table. We brought hardworking brothers and sisters with us to politely and respectfully hand deliver these petitions to President and CEO Steve Corwin. Not only did he refuse to even greet the workers or come outside to speak with us as union leaders, he actually had hospital security escort them out of the hospital. Well, I have to say, I did have a brief phone call with Mr. Nespoli the other day, although he thinks he needs his attorney to speak with me more. I don't understand why. He's not a party to this case that we brought. He insists that he represents retirees. I am a retiree. I was speaking to him like I'm speaking to you now. We did speak for a few minutes, and that I'm still waiting for him to get back to me. And he told me it may take a week because his daughter was sick. So I do hope his daughter's well and she's doing okay, and that he does find some time for me. I will also tell you that I did repeatedly ask to speak with Mr. Garrido. Mr. Garrido has not called me back, although I did have a conversation with Ms. Rose Lavaglio, who was from research and negotiations, and it was a lovely conversation. And I did express to her, still, I do need to speak with Mr. Henry. And I've not heard back from him yet either. So in these situations, if you represent us, or you say you represent us, because I know you don't represent us, there's no retiree that has union representation, because we're not supposed to be collective bargaining in retirement. You know why? Because unions are only allowed to bargain for workers that have wages, hours, and work conditions, and a retiree does not have those. That's why we retire with the benefits that we had when we were in employment, and that those benefits stay with us until our death, which is what's in our SPDs, which is what the union should be honoring, not this mess. We sent out a one-pager, and I hope that all of you read it, share it with your union brothers and sisters, invite them to Friday's webinar. We would love to have you, speak with you, share that one-pager with you, read it, ask questions, talk to us, because what you decide today will affect you tomorrow. Your retirement is around the corner, some sooner than others. Some of you are young and you have absolutely no understanding of what Medicare is, Medicare Advantage is. Maybe you think you do know, maybe you're not all that familiar with it. We know, we were once you. You're busy, you got work and overtime and kids and house payments and car payments and second jobs and parents to take care of if your parents are sick. I mean, you have a lot on your table. We get it, we were there. Our lives are in a different chapter right now and you will be here. Listen to us. We have something to share with you that you need to know because you're being misled. And whether that's from the city, whether it's from the MLC, where it's coming from, it's actually coming from several places. We almost sometimes tend to think that maybe the city is trying to divide and conquer, because if they split you against us, then they win. And you think you won, but you really sold yourselves out. And that's what we want to try to prevent. We could see the bigger picture because we're not in it. We're outside the circle. So reading this article today was a little upsetting. This is the January to March public employee press that the district council puts out. Mr. Garrido's in the same situation we are, but he doesn't recognize his same talking points are ours, and he won't call me back. I hope we can work together on this. I think there's a lot we could learn from each other. And I think there's a lot that we could share with you. We know your history. We know your union history. We know the city's bargaining history. After all, we helped legislate and negotiate it. So learn from us. Anyway, thank you for the time to be able to share with you. We will come up with another short video soon on another topic to help you understand all of the nuances of this plan, and that why choice should be left on the table, why retirees should be able to have several plans to choose from, at least more than one, and that everything should stay within the cap of 12-126 of the HIP HMO cap, of which our insurance, even combined with our Medicare B reimbursement, still costs less than an active worker's insurance. We are the least expensive segment that's out there. Anyway, have a great day, and we'll talk to you soon. Please subscribe so that when we do post a video, you get them timely.